Dr. Paul Sonnenthal, Partners in Health. Give us a clinical perspective on oxygen, please, Doctor.
Thank you. And thank you, Leith, as well. And hello to everyone. It's an honor to be here with such a remarkable group of experts involved in the global fight for access to oxygen. So as Tom mentioned, my name's Paul Sonnenthal. I'm a pulmonary and critical care physician, and I'm the Associate Director for Inpatient Medicine and Critical Care at Partners in Health. And what I'd like to do now is step back for a moment and provide a clinical perspective on medical oxygen to contextualize all the incredibly useful information that my colleagues have been providing. So more specifically, what I want to talk about is one, the importance and benefits of oxygen, and then highlight some of the work being done by Partners in Health as a way of showing how clinical efforts can be aligned to complement the biomedical engineering aspect in order to achieve the common goal of a effective, safe, and life-saving oxygen ecosystem. Next slide, please. So one of my goals is to highlight the effects of medical oxygen therapy. So I think this is actually a good place to start. The quote here is from the very first scientific account on the use of medical oxygen by George Holtzapfel, which he used oxygen to save the life of a young man with pneumonia in a hospital in Pennsylvania in the United States. And this was in 1885. And the point here is that the life-saving effects of oxygen are well known, they're not new, and that's something that many organizations, including us at Partners in Health, have known for a long time. And so we don't exactly have a lot of studies that show the impact of oxygen compared to no oxygen, the kind of gold standard randomized controlled trial, because that would be like doing a study comparing jumping out of an airplane with a parachute compared to without a parachute. But what we do know is that cells in the body, when they're starved of oxygen, undergo stress and eventually die. And so for people on the human level, we interpret that to mean when blood oxygen levels, which normally run about 98% or higher, reach around 92%, we need to provide them with supplemental oxygen. Next slide, please. And so this is just a brief snapshot of all the places where my colleagues at Partners in Health have been working for, in some cases, decades. And at many of these sites, we've been working just as long in partnership with Build Health International to ensure access to oxygen as a foundational aspect of high quality health systems. And you'll be hearing more from Jim Amsara, the head of Build Health International, later. Next slide. So we know that there is a tremendous need for oxygen worldwide. And it's actually not just about COVID, although COVID has highlighted the importance of it and also stretched insecure oxygen systems to the breaking point. But closing this gap in oxygen really has the potential to save a tremendous number of lives. And the best information we have about the impact of oxygen and what it can do for patients in a hospital comes from a study published in 2001 in The Lancet. And it was done in Papua New Guinea, and it took a number of hospitals without improved oxygen systems and conducted an intervention which included access to pulse oximetry, basic training for clinicians, and access to concentrators. And it showed that oxygen or childhood pneumonia deaths decreased by 35%. But more than that, deaths across the entire hospital decreased. And while that may just be, a signal that is more noise than an actual effect, I think it makes a lot of sense because oxygen is just so fundamental to supportive care in treating many diseases. On top of that, Without oxygen, the health system itself becomes fragmented. You can't transport patients to higher levels of care because if they can't have oxygen when they travel, it's not safe for them to travel. And also, because oxygen is so essential to treating COVID, I would argue that it also makes it essential for prevention of COVID. And what I mean by that is, if there's oxygen available at a facility and the community knows that's somewhere people can go to be treated, when they have a loved one that's showing symptoms of COVID, it would make sense to take them there and help them get therapy. But if there wasn't oxygen available and people just knew the hospital is somewhere someone goes to die when they have severe COVID, it's much more likely people will stay at home with their loved ones, making infection prevention and control more challenging, increasing the risk of transmission to household contacts. And I would also say that it builds trust in the health system when you have access to oxygen. People believe that it's a health system that's designed to treat, support, and help members of the community. And I think that goes a long way to potentially fighting vaccine hesitancy as we move forward and try and vaccinate people throughout the world. Next slide. So this image is basically a schematic of the path oxygen takes from generation all the way to the patient. And it's a complicated path. And although oxygen is a medication, there are also some unique features to it. It requires the right dose at the right time, and gaps in administration as short as minutes can be catastrophic. And so understanding this pathway and ensuring its seamless functioning is key to effective use of oxygen. And so the question is, where does the clinical perspective fit into this? Next slide. And I think really the clinicians have a role in bridging the gap between understanding oxygen sources such as portable oxygen concentrators, cylinders, and high pressure pipes, either from liquid sources or from a PSA plant, and helping to establish the needed sources and then understand how to use them effectively and bring them that last step to the patient. But there's significant overlap along this pathway with the role of biomedical engineering. And because of that, I think a clinical perspective in the oxygen ecosystem, working hand in hand with the biomedical engineer perspective, is essential for successful functioning. Next slide. So I want to just briefly talk about how we bridge that gap, how we ensure the seamless transition from oxygen separation unit or PSA plant to piping to cylinder and then to the patient. Next slide, please. So at Partners in Health, we don't see it necessarily as an innovation. There's some new insight or new technology that's needed to solve this issue and bridge this gap. Instead, it's a network of time-tested and proven interventions working all together to ensure that we have the trained staff, both in terms of maintenance and clinicians, as well as clinical protocols that can guide the use of effective oxygen and help clinicians to understand how to match oxygen source with oxygen delivery method, and making sure that the adequate supplies like oxygen tubing, oxygen mask, nasal cannula, pulse oximeters are all available. Next slide. So to illustrate and put some color into these steps, I'm mentioning some of the things that Partners in Health has been doing for a long time and also stepped up during the times of COVID. So tapping our network of experts and experts beyond just Partners in Health, we've developed a number of guides including the covidprotocols.org, which I'm going to include in the chat. And I'll send a link there. We also provide training, a number of training activities across all types of topics, and then long-term mentorship. Next slide, please. And we develop systems and processes that can be used effectively. So triage to identify patients and screening patients for hypoxemia, effective use of pulse oximeters. We've experienced with isolation wards setting up the space, which is also incredibly important, as well as lab systems and informatics. And all of these are necessary, I believe, for a functioning oxygen ecosystem. Next slide. And then we come to equipment and supplies. So clinicians need the right things in the right quantity at the right time. And so that requires sophisticated communication between clinical and clinical operations teams, as well as well-established in-country and global supply chain. And our efforts to this effect have been successful in procuring a large amount of supplies in a challenging procurement environment. And all of these steps together is what I believe, and I argue, is needed to accompany the biomedical aspects of oxygen delivery so that we work as a comprehensive team to successfully deliver oxygen to our patients. And next slide. And so I thank you all for your time, and back to you, Tom.
Wow, thanks so much, Paul.